All right, so get this today.
Yeah.
We're going to do a deep dive into the world of private duty home care.
Okay.
You know those agencies that help people get care in their homes?
Yeah, after surgery or if they just need a little extra help.
Exactly.
Yeah.
We're going to uncover some really surprising stuff about how these agencies market themselves and find new clients.
Interesting.
Yeah, you sent over a bunch of articles.
Mm-hmm.
And I have to say, some of this advice is pretty counterintuitive.
It is a field where the human touch is so important,
Yeah.
but you also got to look at the business side of things, right?
Exactly.
Yeah.
And that's where it gets interesting.
Okay.
One article claims that private duty agencies could actually double their revenue with the right sales compensation plan.
Double.
Double. I mean, who wouldn't want that?
That's a bold claim.
Right.
But it makes you wonder, what are they doing differently?
Yeah.
The key here is focusing on the value of the clients a salesperson brings in,
Okay.
not just the number of clients.
So it's not about getting as many people as possible signed up. It's about finding the clients who really need those services.
Exactly.
And will use them long term.
It's about maximizing profitability for the agency
Okay.
and ensuring they can provide the best possible care to those who need it most.
Got it.
Consultant Michael Giudice, who's designed a lot of these plans,
Mm-hmm.
says a common mistake is rewarding salespeople just for getting any new client in the door.
Which makes sense on the surface.
Yeah.
But as you said, it's not the whole picture.
He uses this example. Imagine two salespeople.
Okay.
One brings in a ton of clients who only need a couple of hours of service each week.
Okay.
The other brings in fewer clients,
Mm-hmm.
but those clients need help for many hours a day.
Wow.
Who do you think is bringing in more revenue for the agency?
It sounds like the salesperson with fewer clients but who need more care is actually the more valuable one.
Exactly.
Even though it might not seem that way at first.
So Giudice recommends a compensation plan
Okay.
that includes a solid base salary around 65%, and the rest is based on commissions and bonuses tied to the actual value of the new business they generate.
I see.
It's not just about how many people they sign up, it's about how many hours of care those clients need.
Okay. I'm starting to see how that would shift the focus.
Yeah.
So instead of just trying to hit a certain number of new clients,
Right.
the salesperson is actually incentivized to find those clients who need more comprehensive care,
Mm-hmm.
which benefits everyone in the long run.
That's the idea.
Yeah.
And some agencies take it a step further by adding tiered bonuses.
Okay.
So if you exceed your goals by a certain percentage, you get an even bigger bonus.
It's like leveling up in a video game.
Right.
Keeps things interesting and encourages salespeople to go above and beyond.
It's a smart strategy.
Yeah.
But,
Yeah.
money isn't the only motivator.
Sure.
Recognition and appreciation go a long way, too.
Oh, absolutely.
A simple thank you or a shout out for a job well done can make people feel valued and reduce turnover, which is really important in a field where trust and relationships are so important.
Absolutely. Speaking of real-world examples, we have a great story here about a guy named Bob Hebert, VP of Carefree Home Care Companion Service.
Okay.
He ran his business for 13 years, relying solely on word-of-mouth marketing.
Wow.
Then he finally decided to hire a dedicated marketer.
Okay.
But get this, he tied their compensation directly to the profit they bring in.
That's a bold move.
Right.
I'm guessing it really motivated that marketer to find those high-value clients we were just talking about.
Oh, yeah. And the article even walks us through how he calculated it all.
Okay.
First, they figured out the gross profit the agency makes per hour of service. Let's say it's $10, just for our example.
Right.
Then they calculated the marketer's total monthly costs,
Okay.
including salary, taxes, benefits,
Right.
even things like gas for client visits.
Sure.
Let's say that came to $5,000.
So to break even, the marketer needs to bring in enough clients to generate $5,000 in profit,
Right.
which in this case would be 500 hours of service.
Right.
Anything above that, and they start earning a commission.
Okay.
It's a really transparent system.
Exactly.
Yeah.
Hebert used a commission rate of 50 cents per hour in his example,
Mm-hmm.
but that could vary depending on the agency.
Sure.
The point is the marketer is directly rewarded for the value they bring to the company.
And it gets even more interesting.
Hold on, before we get too far ahead.
Okay.
I think it's important to highlight what's really fascinating about this example.
Okay.
Hebert's philosophy is basically the more the salesperson makes, the more the company makes.
I like that.
It's a win-win.
Yeah.
It shows real trust in his marketer and a commitment to shared success.
That's a great point. And it's a stark contrast to those compensation plans that have caps on earnings.
Right.
When you cap earnings, you're limiting the potential of both the individual and the company.
Now, this next example is fascinating because it shifts the focus from salespeople to scheduling managers.
Okay.
They're the ones often closing the deals in home care. Caregivers America implemented a value-measured bonus system for their schedulers and saw a 35% revenue increase in just 1 year.
A 35% increase.
Yeah.
That's incredible.
Tell me more about how this bonus system works.
Okay.
It's similar to what we just discussed, but with a tiered bonus structure.
Okay.
Schedulers get bonuses based on both the number of clients they schedule and the number of hours those clients need.
So it incentivizes them to not just fill schedules,
Right.
but to find clients who require more comprehensive care.
Exactly. It seems to be working incredibly well.
Wow.
The owner, Paul Bartoletti, said it makes the schedulers feel like they're entrepreneurs,
I love that.
which is a fantastic way to foster ownership and engagement.
It really highlights the importance of aligning individual incentive with the overall goals of the organization.
Yeah.
When everyone is working towards the same outcome, that's when you see real magic happen.
Okay, we've talked a lot about compensation.
Mm-hmm.
But let's switch gears a bit and talk about something I know a lot of private duty agencies struggle with.
Okay.
Getting referrals from hospitals.
It can feel like hitting a brick wall,
Yeah.
especially when trying to work with discharged planners.
Right.
The source material actually calls hospitals the dead zone for private duty referrals.
Dead zone.
Yeah.
Wow. That sounds ominous, but don't despair.
No.
There's more to the story, right?
Right. We're going to learn why that is, and then we'll explore some alternative paths that might surprise you.
Okay,
Sounds good.
let's do it.
It seems counterintuitive that a place with so many people needing care would be a dead zone for referrals.
Right. You would think hospitals would be a prime spot to connect with potential clients.
Yeah.
But it turns out there are some roadblocks.
One of the sources mentioned a focus group with discharge planners,
Right.
and their responses were pretty eye-opening.
Interesting.
They talked about how private duty referrals are time-consuming and how many patients can't afford it.
Right.
They also expressed discomfort recommending a service that's not typically covered by insurance.
So it sounds like they see private duty care as luxury service, something that's nice to have, but not essential.
That's a perception that agencies really need to challenge.
Okay.
Private duty care can be crucial for patient recovery,
Yeah.
especially for those who lack a strong support system at home.
Mm-hmm.
It can prevent hospital readmissions,
Right.
reduce complications,
Yeah.
and improve overall well-being.
So it's not just about comfort.
Right.
It's about safety and positive outcomes.
It sounds like a communication gap.
Yeah. How can agencies bridge that gap and change those perceptions?
Well, education is definitely a big part of it.
Okay.
Agencies need to clearly articulate the value they bring,
Mm-hmm.
both to patients and to the hospital system as a whole.
So instead of just focusing on the individual patient,
Right.
agencies need to show hospitals how private duty care can benefit the entire system.
Exactly.
It's about thinking bigger picture.
But it goes beyond just talking points.
Okay.
Agencies need to demonstrate their value through their actions. That means providing exceptional care, being reliable and responsive,
Okay.
and building strong relationships with hospital staff.
So it's about proving that they're not just a business.
Mm-hmm.
They're invested in the well-being of the community.
Right. And when agencies can successfully shift that perception,
Yeah.
the dead zone starts to transform into a fertile ground for referrals.
Okay, so even though discharge planners might be a tough nut to crack,
Right.
there are other ways to connect with potential clients within a hospital.
Yeah.
The source material talks about looking beyond the traditional discharge planning route to find other, often overlooked referral sources within the hospital.
Think of a hospital like a small city
Okay.
with all sorts of different departments and people coming and going.
Yeah.
There are so many opportunities to connect with patients who might benefit from private duty care.
Give me some examples.
Yeah.
What are some of those hidden referral sources that agencies might be overlooking?
Well, one area that often gets overlooked is the emergency room and short stay units. These units see patients who might not be formally admitted to the hospital,
Mm-hmm.
so they don't have access to traditional discharge planning services.
Right.
But many of those patients could still benefit from some extra help when they go home.
That makes a lot of sense. It's like catching people before they fall through the cracks.
Yeah.
What are some other unexpected places to look for referrals within a hospital?
Patient services or nursing administration can be a great resource.
Okay.
They might need help finding bedside sitters for patients who need extra attention.
Okay. And a bedside sitter is basically someone who stays with a patient in the hospital
Yes,
to provide companionship and make sure they are safe and comfortable.
exactly. It can be a huge relief for families and nurses.
Yeah.
And often those patients end up needing continued care at home after they are discharged.
It sounds like a natural stepping stone to private duty home care.
Right.
What else is on the list?
Another good option is cancer care centers.
Okay.
Many patients undergoing treatment experience fatigue and weakness that make home care a necessity.
Makes sense.
And then there's volunteer services and pastoral care.
Yeah.
They often have strong relationships with patients and their families
Yeah.
and can be valuable referral sources.
These are all departments that most agencies probably wouldn't even think to approach.
And that's exactly why they can be so valuable.
Right.
You're not competing with a bunch of other agencies vying for their attention.
Yeah.
Remember, word of mouth travels fast in a hospital environment.
It does.
If you build a good relationship with one department, it's likely to spread.
Okay, so we've got emergency and short stay units,
Yeah.
patient services, cancer care centers,
Yeah.
volunteer services,
Yes.
pastoral care.
Uh-huh.
Any other hidden gems in this hospital city?
Well, there's parish nursing,
Okay.
which is connected to faith-based hospitals.
Yeah.
These nurses visit homebound individuals in the community and are always looking for resources to share.
Got it.
Then there's outpatient services,
Yeah.
which coordinates procedures and treatments that don't require hospitalization.
Mm-hmm.
But these procedures can often still leave patients needing assistance at home.
Right.
And finally, there are orthopedic units,
Go ahead.
where patients recovering from surgeries or injuries often have mobility issues
Yeah.
and would benefit greatly from private duty care.
Wow. That is a comprehensive list. It really shows that there are opportunities everywhere if you know where to look.
And it emphasizes the power of relationship building.
Okay.
It's not just about dropping off brochures and hoping for the best.
Right.
It's about taking the time to connect with people, understand their needs, and demonstrate how your agency can be a valuable partner.
So it's not just about finding these alternative referral sources.
Right.
It's about building genuine relationships with them,
Exactly.
educating them about the value of private duty care.
Remember, these individuals and departments may not be as familiar with private duty home care as discharge planners are.
Right.
So be prepared to educate them about your services,
Hey.
the benefits they offer to patients, and how you can make their jobs easier.
We've talked about creative compensation strategies, uncovering hidden referral sources, and shifting perceptions about private duty care.
Right.
Before we wrap up, is there anything else in these articles that stood out to you?
You know, something we haven't touched on yet is the importance of marketing.
Okay.
Hospital referrals are great,
Right.
but there are many other ways to reach potential clients.
Let's talk about that.
Okay.
What are some effective marketing strategies for private duty home care agencies?
Well, building relationships with physicians is key.
Okay.
They are often the first point of contact for people who need care.
Yeah.
Assisted living facilities and community organizations can also be great referral sources.
So it's about expanding your network beyond just hospitals.
Right, and don't forget about networking events, health fairs, and even online advertising. There are so many ways to reach your target audience, but no matter what strategy you use, it's important to tailor your message to the specific needs and desires of your ideal client.
Can you give me an example of what that might look like?
Instead of just saying, we provide home care services, you could say something like, we understand the challenges of recovering from surgery at home, and we're here to provide the compassionate support you need to heal comfortably and regain your independence.
It's about selling the feeling, not just the service.
And remember, actions speak louder than words.
Absolutely.
Your reputation is your most valuable marketing asset.
I agree.
Providing exceptional care, going above and beyond for your clients, and building a strong reputation within the community will do more for your business than any fancy brochure or website ever could.
So it's a combination of targeted marketing and a genuine commitment to excellence that really makes a difference.
Absolutely. Speaking of excellence, we've talked a lot about motivating salespeople and finding new clients.
Right.
We can't forget about the caregivers themselves.
That's so true.
They are the ones who are actually delivering the care and making a difference in people's lives.
We can't overlook the human element in all of this.
Exactly.
How can agencies ensure that their caregivers feel valued and motivated to provide the best possible service?
That's a great question and a perfect segue into the final part of our deep dive.
We've covered so much ground today.
No, right?
From compensation plans to referral strategies to marketing tips.
That's a lot.
It's clear that private duty home care is a multifaceted industry.
And as with any service-based industry, the people involved play a huge role in its success.
Yeah.
We talked about incentivizing salespeople and schedulers.
Right.
But what about the caregivers themselves?
Yeah.
They're at the heart and soul of home care. The ones on the front lines providing the actual service.
It's easy to get caught up in the business side of things.
It is.
But you're absolutely right. We can't forget about the people who are actually delivering the care.
Exactly, and that's where leadership comes in. It's about creating a work environment where caregivers feel supported, appreciated, and empowered to make a difference in their clients' lives.
Yeah.
It's about investing in their training and development, providing opportunities for growth,
Right.
and fostering a culture of respect and recognition.
I imagine that can be challenging in an industry that's known for high turnover rates.
It's definitely a hurdle, but agencies that prioritize their caregivers' well-being reap the rewards.
Interesting. How so?
When caregivers feel valued, they're more likely to stay with the agency,
Okay.
which means clients benefit from consistent, high-quality care.
It creates a ripple effect of positivity.
Exactly.
Happy caregivers lead to happy clients.
Yes.
Which ultimately leads to a more successful agency.
Precisely. And it goes beyond just keeping caregivers happy.
Okay.
It's about empowering them to be true advocates for their clients, to be attentive to their needs,
Right.
and to go above and beyond to enhance their quality of life.
That reminds me of something we touched on earlier, the human element.
Yes.
It's so easy to get caught up in the numbers and the strategies.
Yeah, I know.
But at the end of the day, home care is about people caring for people.
Couldn't have said it better myself. It's about recognizing that behind every referral, every client, there's a human story, a life that deserves to be treated with dignity and respect.
Yeah.
And when agencies can instill that value in their caregivers,
Right.
it shines through in the care they provide.
It sounds like fostering a strong company culture is just as important as any marketing strategy or compensation plan.
Absolutely. And that brings me to a final thought I want to leave our listener with.
Okay.
We've explored these innovative compensation and referral strategies within the context of home care.
Right.
But I think the underlying principles have much broader applications.
I agree. The ideas we've discussed today, thinking outside the box, challenging assumptions, finding creative solutions, those are valuable in any field.
So as you go about your day, your week, your life, I encourage you to consider this. How could these ideas be adapted and applied in your own field, your own industry, your own unique circumstances? What systems could you reimagine?
Yeah.
What perceptions could you shift?
What untapped potential could you unlock by simply asking, what if? It's a powerful reminder that we don't have to accept the status quo.
We don't.
There's always room for innovation and improvement.
Because the possibilities are truly endless when we approach challenges with a spirit of curiosity, innovation, and a deep understanding of the human element.
Well said. This deep dive has been incredibly insightful. Thank you for sharing your expertise with us today.
It's been my pleasure. Until next time, keep exploring, keep questioning, and keep diving deep.